Hello and welcome to another Polestar Pilates Hour. Today we're excited because we are entering into October, which is National Breast Cancer Awareness Month. And I have a dear friend and colleague in the physical therapy, dance, and Pilates world, Dr. Suzanne Martin, with us. Welcome, Suzanne.
Thank you so much for having me, Brent. I'm really excited.
Yeah, I think we've got a lot of people excited to, it's a topic that's sensitive, not just because we're talking about breast, but we're talking about cancer, and we're talking about, people don't like talking about cancer. And that's what the whole purpose of this month is to heighten the awareness, and for us, particularly in the Pilates world, to start becoming a little more familiar with breast cancer, with how we can truly be very beneficial, which you'll be talking about in a little bit as you share a message with us. So while we're waiting for people to come on, if our guest would be nice enough just to do a little shout out in the web chat and let us know where you're joining us from, and let Dr. Martin see what's happening out there in the Polestar world, showing her our support. We're excited to move through this presentation. I've seen parts and pieces of it, and excited because I think there's some valuable things that tie back in the history of Pilates in particular, as well as in our profession as movement therapists and practitioners and body workers. So while you're coming on and joining us, I want to just do a little introduction, a little bit more with Suzanne. Well, I've known Suzanne for a couple decades, maybe almost 3 decades now. It's been quite a while. We both from California, both physical therapists, both from the dance world, participated in IADMs and other conferences like that. One of the things that's really exciting about Suzanne's work is that she has been trained in lymphatic drainage. She's been trained in a number of other modalities in physical therapy, but she is also a gold certified Pilates master in the NCPT, and that's exciting for us. And she's certified with ACSM in cancer exercise specialist and ACSM exercise physiologist. So she comes with a lot of knowledge. She's been the author of a number of fitness books that are out there. We'll be posting a lot of these links for you afterwards in the post-production. She's been the lead therapist for SMU and Contemporary Ballet in San Francisco for over 25 years. And like me, she left California and moved out to Georgia. I didn't even ask you why, but I mean, I know why I did. But always we've been involved with dance companies and working in the dance medicine world. And I guess just knowing that also she has always been very active in presenting in professional forums and doing the research and the education around the world. So good to have you with us, Suzanne.
Thank you. Thank you very much.
You bet. I don't know if you got a chance to see some of the shout outs.
I'm looking at
on
this.
The
it's
side.
Amazing. Yeah. Hi, everybody. And here's even somebody from Marietta. Hello. Hello to everyone. And I know that there's some people that I know that are coming on today too. So hello to them, and even Greece. And Greece is a place that I was able to do a breast cancer presentation and many years ago. But yeah, we've got a good Portugal, Cincinnati, wow, Chicago, everywhere, Vermont.
Let's talk a little bit before we bring up the slides. Just maybe share a little bit about your interest in and sort of purpose of wanting to increase awareness of breast cancer, both as a physical therapist, as a Pilates teacher, in the exercise world. What are some of your thoughts on increasing the awareness?
Well, actually, I was very reluctant coming into this field. That my mother passed away from breast cancer in 1998, and I'll show you her picture pretty soon. So I kind of didn't want to have anything to do with it. But then when we were all starting to do presentations, and Nora St. John asked me to start presenting eons ago at Body, Mind, Spirit, before Balanced Body had started their education, was that I was doing something on the upper core, which was just for repetitive motion exercises. And somebody came up to me afterwards and said, I had breast cancer and these exercises are really helping me. And so, she talked to me for a long time. And then I said, okay, I guess I'll take it on. And so that's when I decided to get educated. And so that's when I started in physical therapy. I was a physical therapist by then. And so then I started to seek out people I could be trained from. And there was somebody who was doing that in Milwaukee, I believe, at the time. And so she just happened to come to my area. And then I found out I was actually did the beta test for American College of Sports Medicine, and now for their cancer exercise specialists. And so now that's on the forefront, the ACSM, for just establishing general exercise guidelines for cancer. And so then I thought I should get more educated, and I went into lymphatic studies. And so anyway, it just evolved. And then I started to do summertime courses at my studio in Alameda, California. And then I decided to do whole programs around that. And so then I'll show you the slides from that. The case that I'll show you pretty soon is actually from one of the people who came 3 different summers for that, and then turned her whole studio into a cancer-based studio, a movement dysfunction studio, and started a whole nonprofit. So that's really what I want to highlight. And then actually, I even opened up into more kind of cancers. As a manual therapist, I studied a lot of more osteopathic techniques. And so I've worked with many, many different kinds of cancers manually. And then I opened up my courses actually to the gynecologic ones too as well.
That's great. And I do think that life sort of takes us down those pathways. We start with something and one area of interest, and one that you'll share with us in a little bit that is very personal, but then continuing to go on from there and realize how the doors open and bringing certain levels of expertise into our practice and to be able to help our clients. All right, Suzanne, off you go.
Okay, well, I decided to name it From Daunting to Doable, because that's just it. A lot of people are reluctant, or they don't know what to think about cancer as teachers, that sometimes it can be frightening. And sometimes people have misconceptions about working with cancer, and that it might be dangerous for the teacher to be working with somebody with cancer. And actually it's not. So let's go to the next one. And so this is our big month for October. And so this is one of the first months that got a designation for a specific type of cancer. And so it's just wonderful. But for people who are over 50, 1 in 8 people are going to develop some kind of cancer. So part of it is, like Brent was saying, to take the stigma out of it, to make it more mainstream, that this is another illness. And frankly, breast cancer is one that many people are able to survive from, because as we're getting older and older, it's going to double by 2050. The amount of older people, we're going to have more and more of those people coming into our studios. So let's go to the next one. So this is our Elder Eve Gentry. I love this picture because it was from Dance Magazine. And so there was another caption on this, which says, "Dig the belly, step flippers." And I was like, yeah, that's true. Look at those. So she's the one that gives us a lot of hope. And I was so fortunate to be able to, and Brent said he was too, to be able to work with her before she passed away in New Mexico. And I remember being there at the St. Francis at that time that I was being trained by. We all went, and we said, well, Eve, what do you think about Pilates for cancer? And she said, well, sometimes it's good not to stir up the metabolism. Well, that was a long time ago, because that was in the early 90s that I went. And we have a lot of research since then to show that it's very, very safe to work with breast cancer people. But the problem is that you really need to learn about it a little bit, so that, yes, you don't get hurt, they don't get hurt, nobody gets hurt. And actually not only get hurt, but actually be effective in what we're doing, and to have a good idea of what to do. So I really like to show this. And there's a wonderful video that you can get that Michelle Larson narrates, and she did a wonderful job because she was a teacher with Eve. And so there are a number of people who are in Eve's orbit that prepared this DVD, and it is awesome.
You know, back in the time, and I had a chance to be with her in like 92, 93, and Elizabeth Larkin, I had spent some time studying with her and also with Michelle Larson. But it was interesting listening to her stories about it, and how Joe wanted to show the medical community in New York that, you know, his exercise system was very effective even for a radical mastectomy. And you got to think back in those days, you know, late 50s and early 60s, radical mastectomy, I mean, they were often scraping down well past the pectoral fascial limits on it. And, you know, you think of, even when you see the videos, what happened was the doctors didn't believe that she had had a mastectomy. She had a prosthesis in her bra in the first demonstration. And so she just said she's a modern dancer and was very comfortable with it. And she just, took off her top and did the exercises for the doctor, showing them that she was able to do those things following a radical mastectomy. I believe it was the left side, I think, if I remember correctly.
Yeah, I believe it was left, yeah.
And just being able to see what she was able to do. And you have to think now, going back and as a physical therapist, thinking of how did he re-educate, the shoulder girdle coming back from a radical mastectomy back in those years, especially with a lot of the scarring and the tissue and the type of treatments were much more primitive than what we see today. But it just was, she was so sensitive to that and really had that whole concept of pre-Pilates and preparing and being able to work with people that had, different impairments and different types of restrictions.
Yeah, and I believe that Michelle said you really couldn't, the only thing that you could probably see it in was when she would do a shoulder stand, that there would be a little bit of imbalance, but not any problem with it, really. Yeah, so let's go to the next one. So this next one is of my mother. And so this is actually my mother just before she passed away, because I took her to Hawaii the summer before she, I was just reading that one, the summer before that she passed away. And she didn't know that she was dying at this point. So, she lived a long life in remission. So I just wanted to tell people that actually there is a life afterwards, and she lived to 82. So I believe that, she lived an appropriate amount of time and she was happy for a lot of it. So let's go on to the next one. So the things that can help with cancer treatment, that we want to increase functional capacity. And what does that mean? Well, it means beyond just taking some measures of just range of motion, armpit, or just general strength. Good, somebody went through the pink ribbon program, that everything's good. And so functional capacity, though, means do the things you want to do, but it does take a little bit in a progression to be able to lift things over the head and to know what the precautions are for lymphedema. And so the post-procedures mobility that goes in stages, right? So it's really helpful for instructors to know, as well as clients, what they can do and what I hate to say what they can't, but actually to establish some kind of restoration sort of progression or some kind of ladder. To decrease the body fat for these endocrinological type of cancers is really important for exercise in general, because it helps to reduce the estrogen that is probably driving the breast cancer. So that's a big reason why even just a walking program is good. And of course, we're trying to preserve lean muscle mass, especially when somebody's going through treatment. And I go through all the different kinds of treatments in the courses, reduced bone mineral density. And then the big thing, though, are the nausea and fatigue. Nausea and fatigue are things that you would not perhaps expect, and what nausea does to you. It's more than just feeling a little sick. It can actually make people throw up and become dehydrated. And then fatigue is not just being sort of tired. And so, of course, we get better mood, self-esteem, and all of that sense of control, because I think of us as like the doulas of cancer. Let's go on to the next one.
So I like that. I like that terminology.
Really, it's like more than just a coach. It's like you need to be a coach plus the actual exercise of overseer. Mm-hmm. And so gentle body awareness, and that's just it. Because a lot of times people will have what we call second insults. So I'll talk about that, is that, yeah, somebody made it through the actual therapies, but now they didn't understand how to go in stages or what they could or could not do. And somebody's just telling them to stretch. I had a client that afterwards, her nurse just told her to pull her arm up and stretch. Well, then she got rotator cuff tear. Plus she had frozen shoulder. I mean, lots of these things are common afterwards. So you want to go in progressive rehabilitation. Obviously, it's body and mind. And the thing about the sensation of the upper body, it's profound. In the homunculus, just the map of the brain, the little man inside, you wouldn't believe the amount of sensory representation for the arms, for the face. All this area is so sensitive. And so this is one thing to really regard and help a person to navigate through. Is this soft tissue? Is it my bone? Is it time to worry? And just help them to get used to their own sensations. And then it is a personal attention. I mean, these kinds of reproductive cancers really hit people home in their identities. So it's more than just, I hate to say just a knee injury, because I've had a hip replacement, so I understand that. But this hits you to what your identification is as a person. And then the Pilates tends to be non-competitive, and it focuses definitely on self-care and improvement. And a lot of people don't know how to do that. So we help to show them.
That's such a good point, Suzanne, about, we talk about whole body health, whole body wellness. And I remember, like you, I've also had a hip replacement. I remember the biggest struggle for me was thinking, like, do I really want to put more artificial parts in my body? Does that still allow me to be whole body? But then I was corrected quickly on things that I had been teaching for years, as it's about whole body function. And then when you think of something that is as personal as a breast or genitalia or the womb or a testicle being removed from somebody, that we create so much identity so often around those body parts, any body part really. You think of if a professional soccer player loses a leg or something like that, I mean, that's the identity goes out the window. And I think that we all have to work on being capable of coaching the idea of identity. And that is particularly in these types of cases where you're talking about reproductive organs and sensitive organs that identify your gender often, or identify your career, or identify sort of your perception of self, that we need to be able to coach them in looking for what, if we ask those questions from Buddha, who am I? Is who I am identifying with, is that part of our body parts, or is it something much deeper and spiritual for us? And I know that, because we bring mindfulness in our work, that is such a powerful tool for us to be able to help people navigate that rediscovery. And we know that because people who identify deeply in their spirit seem to have less struggle going through these types of procedures. And those who identify by their body, which many of us as dancers or movers identify by our body, and something is changed, it often messes with our identity. And that's where the struggle comes from. And that's why I appreciate you really bringing up the idea of, like, how do we help them to explore and to reconnect with self through these types of struggles and challenges that they're having. Very powerful.
Yeah, and I'd like to make a little shout out on that about Emily Garfield. So when I said I expanded to the pelvic region for cancer, Emily is now a coach, and she's gone through an amazing amount of pelvic surgeries. And so that's what it is now they're actually she's become a cancer coach. And so there are many more people taking this on now, and those are good roles too. But yes, we have the opportunity to begin that conversation and to help to hold people's hands, because it's an intense process. So why we should help? Well, one is that, honestly, I do believe that we can prevent unnecessary disability. Now, having said that, I have a client who just contacted me, and she just went through a prophylactic bilateral mastectomy. Now, the thing is that you would think somebody who would have that prophylactically would not have any problems. But unfortunately, this person has now developed frozen shoulder and is now going to undergo a procedure for manipulation under anesthesia, which means that when you're put under, because the shoulder has closed over in its adhesive capsulitis and is now stiff, and stiff, now they put you under anesthesia and then literally just kind of tear it open. So we're trying to help people avoid those situations. So that's what unnecessary disability is just that if somehow we can be whole with people and be with them prehab or the pre-Pilates, like what Eve was saying, for sure. And frankly, what's amazing to me was, as I started to do this work, there were so many of my clients who came out of the woodwork that were suddenly either going for a biopsy or, it just became so abundant. So anyway, provide support for the whole patient, not just the cancer, because that's just it. In the American College of Sports Medicine, they do a wonderful job. But there's general exercise, which is good. Okay, so I need cardio, I need to do strength training. All of those things give me general health, but then I need more specialized things. And one thing I like to talk about with Pilates is Pilates, I believe, has like 3 aspects. So it has the somatics, where you're getting more of your one-to-one internal environment matched up with how you want to be and how you want to move. And then we have the correctives. Okay, so I had reconstruction of this type. This is the kind of correction I'm going to do. And then we go into full conditioning. is because even Pilates said himself that Pilates was not enough. But although we all know that Pilates can definitely get to a level of conditioning, but we want to do appropriate conditioning when we have these kind of situations. But it's like we're honing the saw to go on to do this general exercise, and then we'll make it more effective down the line. So also these effective self-management strategies, everybody needs to learn a program for themselves, and not everything works for every person. So sometimes it's hard for me to suss out what my personal program is to maintain my health, obviously to restore movement and function, and then honestly to help manage fatigue. So it is really draining. And so people need to be encouraged and to roll with the punches. And one way I like to explain it is that in doing a lot of the cancer kind of treatments, it's like running a marathon. I had somebody text me one time who was going through a very hard part in her cancer trajectory. And she says, I'm throwing up and I'm having a hard time. I said, look, see those runners on the marathon? You can see them by the side of the road. They're standing there throwing up, but they trained to do that marathon. And if they just keep taking care of themselves, throwing up, restoring themselves for the moment, and then keeping going on, then they'll go to the finish line. So I think of the cancer treatment trajectory a little bit like that. Now, not everyone goes through such a large treatment. That's true. But to try to help someone to see that there's stages in the treatment that will be uncomfortable, and everyone has to decide for themselves what they're willing to do. But sometimes just a little bit of encouragement can go a long way, and then they'll see the other side.
There's a comment that, of course, cancer is complex and each case is different and each client is different. And they may have cancer on top of another condition or on top of another existing anxiety, et cetera. But our role to be supportive and listen deeply to the client to give them hope. And I was just thinking of how, I can't even remember how many. We were working with a group of oncologists for a while, and they were sending lots of patients that would come into the reformer classes, and they just wanted to be somewhere that was normal, that was not treatment and not sick. And they'd come in and we just gave them permission. It's like, look, if you're feeling, like you can do a couple leg presses and maybe a couple arm arcs, and then you got to rest or you got to run out and throw up or whatever you got to do. It's okay, but you're here and you're part of this class, right? And so there was a social component to it. There was a healthy perception of, look, I'm in my Pilates class. I'm not in, getting an IV drip right now with a bunch of other people that are in the same situation as me. I'm going to go socialize with friends and do those things. Even though half the time, some of these people would just lay on the reformer and just be quiet there. And we gave them permission, just be here. Just be here and do the best you can. And when you feel up to it, you push out and you do the exercises. And when you don't, you don't.
Yeah. And, there's another kind of fatigue too. And it's what you were mentioning. It's basically like treatment fatigue. It's like people asking you about your situation fatigue. And then that was another thing that one person told me. She says, I don't want to, she was a yoga person. I was asking her if she wanted to participate in some of the things I were doing. She goes, look, I don't want to be identified as the cancer girl. So, each person has a different take on it. And we have to respect where they're coming from and what part in it, because after a while, they're just kind of over it.
Yeah.
So, that can be part of it. But the secondary insults are for real. And again, allowing them to be where they are at the moment. I had one person come in and I found out, it wasn't until he was on the reformer that he actually told me what his hematocrit was. And it was so low. I don't know how he came into the studio, but he just wanted to be there.
There's a comment by Kelly Watson of just, sometimes they come in, like we said, some of them want to be inconspicuous and just be part of the group, and others need that support if they need to cry, if they need to be held, or they just need to lay on a reformer and be there. And something that Sarah said earlier was just that we would say this about any patient population, right? Is that every individual is different. Every individual is unique. And I think part of our job is identifying, how they want to be addressed, how they want to be treated, so that we're sort of helping them stage themselves. And sometimes I even found myself helping with alignment, right? So alignment of, you're saying something, but is that really what you want? Or do you
Yeah.
really want to have the social support that we provide for you, that you've been coming here for a long time and now you have breast cancer and you're going through treatment, and this is still the same family and the same group that wants to be with you. So even though you sort of want nobody to know about it, do you really not want anybody to know about it, or do you want to have a group that just accepts you exactly as you are? And I've had both answers. I've had somebody say, no, I just really want to stay inconspicuous, and others saying, start crying and saying, yes, I want to be part of the group and I want them to know. And, how do you want to tell them? So again, listening, this sort of goes back to Carol Davis's work of the practitioner's interview, right? And it's, how do we seek to understand how they want to participate in these activities, and being able to coach them positively, and again, we're talking about all pathologies. It could be anything, right? Of how we're going to help coach them through these positive movement experiences and this ability to return and participate at some level, even if it's terminal.
And this might sound a little woo-woo, but I do believe that just being in the atmosphere and actually just seeing others move and watching them move, I do believe there's, inside us, it happens.
I don't think it's so woo-woo, Suzanne. I think there's some good research on it.
Oh, good.
There really is. I don't know if you ever met Peggy Roller. She was the director of Cal State Northridge, and she and Don Marie Ikes would ring a bell with you, I think. Don Marie,
Yes,
right?
definitely, yeah.
Well, Don Marie did the study with Peggy Roller, and they were looking at really high-risk falls population down in Southern California. And Peggy had worked with them for years in really expensive vestibular and balance training and those kind of things. And they put together a study where they just went to a Pilates class with a Pilates teacher for, I think it was 8 weeks or 12 weeks, twice a week. And no focus on falls, no focus on falls prevention. And every one of them, 93 subjects, I believe it was, every one of them came out of the risk of falls altogether by just having positive movement experiences with other people who had similar problems. The inclusion criteria was they had to have a fall that took them to the hospital within the last 6 months. So these were high-risk falls, and they had to be high on the fear of falls. And these people came completely out. They were expecting maybe they would come down a notch or two on the fear of fall scale, and they maintained it for 6 months. So I don't think it's so woo-woo. I think that, creating that, we are beings that thrive on being connected to each other. And a lot of times society takes that away from us, but anytime we can, reproduce it, I think it can only improve health. It can only improve perception of self.
This is just to show us that there are tiny lymphatic vessels that start right away underneath the skin, and that then underneath that is fat. And let's go on to the next one. So the little green things are called the fishnet, the first lymphatic fishnet around the body. And then the thing I like to point out is that the breast is a gland. So not everybody understands the anatomy on this. So there's the skin, I say the skin, the fat, and then the shrink wrap. So the shrink wrap is like the scuba outfit of the first deep fascial layer, but the gland sits on top of that on the chest wall. And so a lot of it is trying to get used to our own anatomy. In my courses, I always do a self-lymphatic type of self-treatment so that people will start to be able to even teach. I show both a generalized one and then a more specific one into the actual breast gland, because it's always important for people to test themselves monthly, because lots of times people find it on themselves. So let's go to the next one. And so this is, I hope no one's squeamish, but now this is actually showing some of the fascia. These are the actual nerves in the armpit, in the axilla. And so this is to show you where things can start to get hung up. So it's not just in the actual arm, right? It's the connections of the trunk. And let's go to the next one. And I love this next one that we're looking at, because this shows you indeed is that if we peel off the breast off the chest wall, we're looking at what the ability for gluing down anytime you have surgery, you have swelling. I mean, there's just no two ways about it, because that's the way the immune system starts to heal and to clear things out. So you'd think that it would stay more localized, but no, the adhesions are going to go deep into the chest wall. And this is where then if someone erroneously starts to work just with the arms, you think, oh no, I need to strengthen my arms now, or let me yank on the arms. If I just pull on my arms and stretch my arms in the goalpost every which way, I'm going to be okay. And no, this is when the second insults happen. So this is why it's good to go and get some idea about where to begin and how the anatomy goes and the fascial connections.
Yeah, and not just the surgical, but even, like the radiation and chemo, will damage this tissue significantly as well, that we need to go in and mobilize and free up. I just noticed that the name on this, Andrejaj Pilates, I thought that was pretty cool. That sort of in the place.
Awesome. Everybody should get it. But no, I should say that is that actually in my course too, it helps us start to understand what's the difference between adhesions. And this is why I go through a whole part on how to begin to work with people with, if you put it on your own arm right now, I say this, what you do is you connect lightly, you feel yourself going to the skin, and then you press a little bit more into the pressure. That's the fat layer. And then the shrink wrap is just a little bit more. And then if I start to tug on it just a little bit without really moving the limb, then I'm starting this tensioning. So there's different ways that we can mobilize fascia. One is it helps if you heat it up a little bit with some warmth of breathing. But the other thing too is then that we use decompression techniques with our rollers and different things that we use, and even with our hands. So I have an article this month with Brent Miller with Pilates Intel, and it talks about imprinting. And so that's what I talk about. The first level of imprint is just our own touch. And so one of the first exercises that I teach most people is to put their thumbs into their armpits, and the third fingers come together, third fingers go into the breastbone, thumbs come away. And of course, you're lying down. Breathe in as you exhale out. You feel the gentle pressure go down at the bottom. Press just 3 times, 1, 2, and 3. And breathe into that and keep going back and forth. And that starts to open up the chest wall. And you'd be surprised how much just that simple thing can help to start to get mobilization through these layers. It's like puff pastry layers that are both adhered. And that's true. In the radiation, they've gotten much better about radiation. Lots of it's very targeted. I have a client with cancer, with kidney cancer that I help a lot. And he had a lot of chest radiation, but we have him going to South Africa and all these other kind of places. It's taken a lot to get that going. But there's a difference between general adhesions and then the actual fibrosis that starts to develop from the actual radiation. And there's ways to keep working on that as well. And then actually going into the scars, the actual physical scars of surgery. And then the next, I think, if we keep going to the next, maybe one, well, this just shows the lymphatics. And this is what I was leading up to, is that lots of times in breast cancer, some of the lymph nodes have to be taken out. So in my courses, I like to include a whole section on the lymphatics, and I go a great deal into where they are and how we can move things around. It's all about the circulation. Obviously, this is about for somebody who is doing manual therapy or manual lymphatic drainage. And so the whole idea is to go to the areas that are still open. So if somebody still has an area that has not had lymph nodes taken away from, there's ways that you can direct the fluid around. And the fluid actually can be pushed. And that's the thing that's just amazing and awesome, that it can be pushed around and it uses gravity. In our exercises and our breathing, I even did a whole thing on the reformer to show people how to do a whole lymphatic thing with that. And so there's a lot we can do just with our leg circles. You'd be surprised, and some breathing.
Move it. Suzanne, back in the day when we went through our original trainings, there wasn't really formal training programs back in the early 90s. It's more authoritative learning. We'd go study with somebody and come back and practice it or draw stick figures and those kind of things. But I was telling somebody today, I was talking to Wojciech from Zoga, the PT from Poland that we had on the show last week or the week before. And we were talking about how early on, one of the things that I was trying to understand in Pilates was how the movement affected all the different systems of the body, right? All the different physiological systems. And so one of those was the lymphatic. But he brought up something today, and going back just to the slide, we don't have to go back to it, but thinking of the slide before, and he was talking about how a lot of the new research in myofascial work is looking at interstitial space and interstitial flow, right? So when I teach physiology at the university, we're always talking about the interstitial fluid and the plasma and then the intracellular fluid. So that extracellular fluid is around every cellular framework, and that's the exchange of homeostasis is what's in the extracellular versus the intracellular. And it just clicked in my mind thinking of what you were just talking about is, any time that we can restore some of that interstitial flow and sliding. Again, there's a limit to it. It's not that it's endless. It's not, the tissue's not going to keep sliding, but we know from the fascial science and some of the videos and the research that there's this movement going on, but that movement is only available if that interstitial fluid is supple and it can flow with it, right? And you think of after having any type of surgery on any tissue, especially breast tissue, that we're looking at, how do we restore that interstitial flow? How do we get the tissues moving on top of each other, even at a very cellular level? And this goes back to Carol Davis's talk of, it's like we often were way too heavy-handed in the way that we were treating these things, and that just even how you were showing the light touch and the different layers of touch to be able to affect the interstitial fluid at those different levels, particularly lymphatic fluid, we call it, of getting that flow to move back to tissues that can absorb it or can move it around when those tissues have been damaged locally. So just, again, thinking of two things. One, our movement that we do in Pilates, the whole body movement, is moving that interstitial fluid and is moving the layers. And then if we have the skill set to be able to do the manual work and the hands-on to continue to encourage that, like what Suzanne's talking about with the lymphatic drainage, that's even more powerful of like getting it to move. And you think of maybe, and I'd be interested, Suzanne, like if you were to do the manual lymphatic drainage first and then the exercises following to sort of be able to keep or maintain some of that interstitial flow, or would you go the other way around? And I don't know if you have any preference of...
Actually, I believe in, you can really do a lot for yourself. And so this is one thing, is just to kind of teach this people a self-practice, because it kind of needs to keep moving all the time. And so, yes, I mean, I can do a whole lymphatic treatment on somebody, but I usually keep those in separate realms. But yes, but just even what we're doing in the beginning, where lots of times I'll put somebody on the West Coast baby arc and then go methodically through the different angles of the chest and gently holding them, that starts the story. And then what we do afterwards in the exercises then perpetuates it. But in the actual manual lymphatic drainage, I tend to do that as a separate type of treatment, but I believe that we're doing it all the time in our Pilates sessions. And then when you can direct it a little bit more and then get someone to do a little bit of it with self-practice, because also then teaching them some of that helps them to start to be able to address themselves. Because a lot of times clients are afraid to touch themselves again, or just that they're repulsed by it. They have different emotional content. So then it becomes more normalized. Even if we don't go on the direct localized area, but there's other areas. I call it the knuckle rubs. Sometimes just knuckle rubs, or knowing how to go up into the armpit, or just even starting in the neck, or some place where it's more soothing can be really helpful.
Yeah. Love it.
And so what I was trying to get to, let's go to the next one, because this is what I wanted to point out, is that when the lymphatic vessels are cut, though, is that the lymphatic fluid is very rich with protein. And so what you're seeing is a woman holding a breast up, and there's a little bit of a cord underneath her breast, and that's actually fluid that has gone into a lymphatic vessel and started to solidify. So the thing is once the pH of the fluid changes and it goes into an area that it shouldn't be in, because all of our different areas of our body have different pHs, then it becomes to form almost like an egg white. It pretty much cooks, So, but you can break it down. And then part of our work in Pilates too is to help them to, sometimes these actually break, which is okay, because it might be restricting motion. But you want to address it. And so you can see it's really common in the armpit and the axilla, but I've seen it up above the collarbone. I've seen it down by the waist, in a lot of different places that you wouldn't expect. So that's why working on the whole trunk is really important. And it's all about the circulation and the fluid. So let's go to the next one.
And you and I were talking about that treatment as well before, of just how, women that have had reconstruction after a mastectomy, and so many of them do end up with some of these bands that are restricting them. and sometimes restricting movement as well. So it's like being able to work with that. I love the idea of self-treatment and also being able to, find, I don't want to use the word pleasure, but find gentleness and
Pleasure, yeah.
yeah, pleasure. But you know what I'm saying is like to find love for their body again.
Right.
And we know this when in orthopedics, right? When somebody has an acute knee surgery or total joint, and they look at their leg, if it's their first one, and they're like, I don't know whose leg that is that's attached to me, but it's not my leg, right? And then we gradually have successful experiences, and pretty soon they realize in a month or two that that is their leg and it's doing fine, and they're going to be able to be restored. And I love that idea of us even helping them to have that realization. I just want to reiterate what she had mentioned about making sure that the participants need to see new hope, compassion, and understanding. And she's been working in the Miami Cancer Center for over 7 years and focus on moving for health mentally, emotionally, physically, and spiritually, which we often talk about here in this particular show, is that we want to bring the world physical, emotional, and spiritual alignment. We want people to love themselves, wake up in the morning, feel that they are worthy and divine in nature, and that, a lot of times when we catastrophize or we use certain languages, we actually slow down the progress and the healing phase. If we're creating negative thoughts or even giving food for negative thoughts, they have to create the thoughts. But if we are not catastrophizing it, then it's much better.
This particular slide just shows that there's different stages that people go through. One is that there's a restricted stage in this particular case that I went through, that she needed lymphatic drainage, she had cording, she had fatigue, and she was having a really hard time because her mother died at the same time. She went through a restoration stage, and then she wasn't getting better. And then I had to send her back to an orthopedist, and she had indeed a rotator cuff tear. And so she decided to have a PRP, which is a platelet-rich plasma injection, which did go into the area. And then it really did after that, then it was able to actually heal, and then we could proceed forward. So then she had to go back into a restricted stage, and then in another restoration stage after that. But then she went into reacquisition because her big goal was actually to go to water aerobics because she missed it so much. And then she kept increasing use, and she finally got back to water aerobics, and then finally the refinement stage, where she was a participant in my Survivor Cat course that year, and she got full range of motion back, and she became a happy camper. But it was a rough road. She said, the short story of my nonprofit is that we had to dissolve it because of a serious shortage of capable instructors. I was like, oh my gosh. And then a lot of them retired and then moved when COVID hit. So you see, what I'm trying to say is that all of us around the country, you think there are a number of people doing these things, but we need more. Let's go on to the next slide.
And while you're doing that, there's a great question that came up from Kelly. Again, I know that's what we're going to be talking about right now, is what Andrea is doing and what she's looking forward to now. But just finding reputable programs to become a cancer coach. So again, if we have any links or leads that we could share with the audience, would be great, Suzanne.
Yeah, we need lots of those things. So anyway, I wanted to just give that a little bit of a talk up first, because that's Andrea who was texting me when I was asking for permission to use this. And this is the case that she did. The way she had it organized was that with her nonprofit would give 10 free sessions to a number of people in her community, and actually had gotten large. As a matter of fact, let me tell you, let me read it right. But she said, we were able to give the remainder of our large bank account, because it was a nonprofit for many years. It was quite successful, to local nonprofit organizations serving breast cancer survivors with a heart. She says, so the intention lives on. If you ever meet someone who is interested in starting a project of their own, please send them my way. So guess what, Andrea? Guess what? Here it comes.
Watch out, Andrea.
It's a little her case study, but it's good because it's visual and shows you quick and dirty how she helped this woman. So you see, she had a lady who came in. She decided to use a little posture grid behind her. So let's go to the next one. So you can see then that she's having trouble with reaching one arm up versus the other. And let's keep going. So it's not like this is, some other big measure. Now, this is where functional starts, right? where you start to see the differences in somebody being able to twist one way or the other. Now, when I'm telling people to advising, teachers to, you usually don't tell somebody what you're looking for, and you tell them just turn to the right, turn to left. And probably this person is like an overachiever, trying to show her how far she can go. This isn't necessarily how Asher was teaching her to rotate, right? But you can see there's a big restriction from one side to the other. And let's go to the next one. And so then also this is something called the Apley scratch test. So you see, it's a very quick and dirty thing. It's a functional measure, and you go from the top as well as you can go from the bottom. And then this way you can see really quickly about the tricep in this whole area, and you can see the difference from side to side. You can see even still the amount of swelling on the left arm versus the right. And this is one thing too to learn in the courses is what I call the lymphatic scale, which you can tell by looking at somebody's width of their elbows, the wrists, rings fitting on each other, looking up above the collarbones. So this way you can start to observe your client without telling them necessarily what you're measuring each time. Let's go to the next one. And so you can see in this one that she's definitely having a hard time moving. And there's a very typical movement dysfunction pattern where, of course, it's restricted in external rotation, abduction. And let's go to the next one. And I usually advocate wearing a sleeve during our sessions because once you get the swelling in the arm, it's very difficult to get out. And especially with flights, going on planes, and you really can't do hot tubs, really hot weather. You have to avoid pets scratching on you, things like that. So all of those kind of things are good things to learn about to avoid. And let's go to the next one. There are some fun sleeves too. This is to show the end. See, at the end of this, we have a happy camper. And so Heather's a lot better. And let's go to the next one. And see, her arms are a lot more level. And this is not with manual therapy. This is not doing anything, I hate to say special, except us, what we do. And I hope you don't mind me sharing. Actually, one of the things, and I actually don't necessarily really teach this in my course, one of the things that was the game changer for this woman was being on the trap table, doing like a water ski kind of position. I was like, oh my God. Okay. Well,
The pelvic press, right? With the tower bar.
So,
Wow.
Yeah, exactly. And pulling those shoulders down and getting that stretch. Because again, it's just the chest wall, so getting it in every direction that we can and having fun doing it.
That's great, actually. Amazing information. And I think one of the thing that I'm sort of taking away from today, Suzanne, is just thinking of, how much we can, and I'm going to rephrase it. When we think of the term pathokinesiologist, right? So the idea of that any pathology, surgery, or trauma that impairs somebody's function or movement or quality of life is our specialty. That's what we do. But to be able to say that, we need to be educated in the nuances and some of the unique variables of each pathology, but also taking on that consideration of the whole person and every aspect of them. And I think that's where, the Breast Cancer Awareness Month really brings us to an understanding, and we could talk about this with prostate cancer, we could talk about it with ovarian cancer, we could go through the whole thing. But the idea of being sensitive and really being able to create that hope, being able to create that sense of worth, and creating these positive movement experiences. And I think that's what we're seeing there is that, we want to be able to do assessments. We want to be trained in being able to show that there's improvement and that improvement correlates with function, and that these individuals are able to participate at a higher level. And that sort of takes us back to what we've been talking about for the last 3 years in the ICF model is how do we get people to align their ability to participate with what they believe they should be participating in and helping them navigate through these challenging times. What are some other thoughts that sort of came to your mind as we were talking, Suzanne, just in line with working with breast cancer and sort of seeing some of the questions and the comments pop up? Anything else that you wanted to share with the group?
Well, one of the things that, hi, Debbie, one of the things that is really amazing is that I usually keep a book in my studio called The Wellness Community. And when somebody comes in and they've been diagnosed with it, I hand it to them right away. Because we all are, myself included, we're also distracted with the things we're trying to get done, going from here to there. I've got deadlines, I've got this to do, I've got to turn this in, I've got these people to see, I've got places to go. Everything comes to a screeching halt when you have that army of white lab coats walking toward you down the hall, and you find out that it's you. And so suddenly life becomes real. What does life mean to me?
Yeah.
And it's a big time that a lot of people use for transformation, really.
Yeah. I remember taking some training with Deepak Chopra, and he had one of the, an oncologist that had written a book with him. And it was very much about just for the idea of, find the white coats that you trust in and that you want to work with, and let them do their job. And then spend the rest of the time nurturing your garden and, really having that sort of alignment experience in your life, that you are really living your life and that you are doing all the things you can to be healthy. And I think that, this is where we come in as Pilates teachers and yoga teachers and meditation coaches and life coaches and physical therapists, is that we can help provide that nurturing of the garden. We have to trust in the medicine. The last thing we want is for a patient to have to go to this doctor, and then they don't like that doctor, they go try something else, and then they're going to different countries and they're trying all these different things instead of living their life. And, I learned a lot in that session, particularly with oncology, is that, we encourage them to find a team that they trust, and then trust that team, and then spend our time doing all the things that improve the quality of life. And for us as physical therapists, as a pathokinesiologist, we're not treating the pathology. We're treating the effect of the pathology on function and movement and quality of life. And I would say the same thing as Pilates teachers and yoga teachers, that continuum of care that we provide that continues to restore, a healthy lifestyle and healthy perception of being and healing. And how do we do that? So I really appreciate the information coming on. Do you have anything coming up soon, by the way? Do you have?
Yeah, so in October, I am having a breast cancer course toward the end, I think the 28th, 29th. And I've been, an asymmetry person too. I mean, cancer works with asymmetry too, but aging with asymmetry is happening the weekend before that. And that'll be the rest of my live courses for the rest of the year.
I really believe that whatever we deal with in life is about learning who we are and living our life the best we can, and finding joy and finding happiness, even in the challenges that come through disease and loss and those kind of things. So we're sending good energy to you and appreciate you having the courage to share that with us, and certainly wish you the best. And any way we can help out, we certainly want to be here for our Polestar family.
Absolutely, Ruth. Just one step at a time.
Again, a special thanks to you, Suzanne, for joining us. And just, you've always been a leader, and you and I have been on parallel paths of, combining the three, the dance and movement with Pilates and with physical therapy, and being able to bring a better quality of rehabilitation and movement to people's lives. So thank you so much for your leadership. And we'll look forward to more things coming from you and your writings and your work. And again, we want to thank everybody out there. Polestar, our goal is to bring the world physical, emotional, and spiritual alignment. We couldn't do it without you. We thank all of you that are out there supporting us. Please share it with a friend. And above all things, I ask that we all be kind. Have a wonderful week. And we'll, heads up, this is a really heavy conference time. I don't know if any of you have noticed, but always September, October gets crazy with conferences. So we will not be having a webinar next week, but we will the week after that. So we'll see you in 2 weeks on the webinar. Feel free to go to our library and pick one that you maybe missed before if you're feeling a little deprived of a Polestar Pilates hour. But we are excited to be with you, and we'll be back in 2 weeks. Thank you, everybody.
Thank you, Brent, so much. What a pleasure.